Hello, I'm Matthew Weinstock, Managing Editor for Modern Healthcare. Thanks for tuning in to the latest edition of The Checkup. All 50 states in some way have started to ease the restrictions they've put in place at the beginning of the COVID-19 pandemic. But that's also resulted in some spikes in cases and hospitalizations across the nation, including Arizona, California, and Texas, all states where CommonSpirit has operations. I'm joined today by Marvin O'Quinn, President and Chief Operating Officer of the large not-for-profit health system, to talk about the challenges of operating in a patchwork of state rules and regulations around the pandemic. Marvin, thanks so much for being with us today.
Thank you. It's good to be here.
So as I said, you're operating in California, Arizona, Texas, which have seen spikes. You're in 21 states total. Let's first go to those three states. How worried are you about capacity for your facilities in Arizona, California, and Texas, which have really seen a resurgence of the cases?
Well, certainly we are concerned. When we began this journey back in March, we had three goals. We wanted to make sure our organizations, our hospitals, stayed open to serve their communities. We wanted to protect our staff. And we wanted our leaders to lead both internally and externally. And we've been able to accomplish all of those goals. As we look at our system now, our volume in terms of COVID cases have gone up 120 cases since last Thursday. We have over 800 cases across our system, most of them in the states that you talked about. And the numbers are certainly increasing. So what we've been able to do is to use our size as an advantage. We meet every day with the team to look at where the hotspots are and to determine how we will coordinate activities such as resources behind the scenes, so that we can move them to where they are most needed. And being an organization of our size allows us to do that. In addition, frankly, our team, we have 11 divisions, and those division presidents work very closely with each other. And they, in the areas where things are not as hot, they've been sending staff and resources to the areas where they are hot. We have an extensive modeling system by hospital, by region, and we're able to project where we think future hotspots are going to be. So not only are we concerned about the three areas you talked about, we're also concerned about what's happening in the Central Valley, particularly Bakersfield, where we're also seeing increasing cases. You mentioned San Bernardino, but Los Angeles, we have 4 hospitals there. They've actually never come down. They've only gone up. And so they're at the highest level today that they've ever been at. Fortunately, the ICU utilization there has not been high, so they've been able to keep a good census there in terms of not being pressured in terms to look for more staff. So it is a concern. We are watching it, we're talking about it, and we're managing our resources to point them in the direction where they are most needed.
So can you expand a little bit on that modeling that you're using? Are you using that system-wide, and how is that information being shared across the system?
So what we've done is our clinical operations have developed a number of tools to help the operators manage their way through this crisis. And so we've been working and developed internally, because we have data scientists on staff, and we've been working with an external group called SG2 to develop a modeling capability that's specific to our geographies. And so we're able to look at the hospital level what's happening now and make projections about what's going to happen in the future. And then that is shared with every single hospital president and every division president so they can plan accordingly. And then we use the model at the corporate level to determine where we want to move resources to, or where we'll have to move resources to in the future.
So, what you're seeing in some of the states that we talked about, those 3 states, and some of the other areas that you're seeing you're worried about the spikes again. This comes on the wave of reporting third quarter losses. CommonSpirit certainly wasn't the only organization to have losses in the third quarter. What are your worries about sort of getting back onto a healthy financial footing as you resume some elective procedures elsewhere, but you continue to see a rise in COVID cases?
So, as you know, we began opening our facilities as the states that we are located in opened up. Our clinical operations developed very specific guidelines for opening up institutions, and those were communicated, and our institutions have been following them. As we look forward, the issue is managing the hospital as normal, if you will. Not closing down the institution again to elective and non-urgent cases, which is a bit of a misnomer because many of those cases do turn out to be really important to people's health. And so putting them off doesn't help, it hurts them. And in fact, as we have opened up our institutions, our case mix index has gone much higher than normal because people's situations have deteriorated because they couldn't get in and have their care taken care of. So it's detrimental to the public as a whole if the industry had to go down and close to elective and non-urgent cases again. So our challenge then is, how do we manage this growing COVID population, as well as continue to have the organization open for these other types of cases? We have learned a lot over the last 4 months on how to manage these patients. Testing is critical to identify them quickly so that we can move them in the right direction or give them the right care plan. Having the right level of staff is also vitally important. And the key issue for us, as we've learned, is the ICU bed capacity. And at some point we thought it might be vents. We know testing is always important and having the right level of PPE, but it's the ICU bed capacity that really becomes the critical path here. And so we are actively looking at how to increase that capacity in the areas where we know they're going to be hotspots, both physically, because you got to have the beds available. In a lot of cases we do, but then you got to get the staffing. And so we're, again, using our size, the combined organization, to be able to move some staff, because our nurses want to work and they want to help out. And so we're developing an internal program to move staff, say, from one state to another. And we're also using our relationships with the traveler agencies to bring in more nurses in these areas where there are hotspots. But the overall goal is, and the challenge is going to be, managing the COVID population and at the same time managing really a normal hospital operation all in the same facility.
Right. It's a lot to do. CommonSpirit has some rural facilities as well throughout your network. So what unique challenges has that presented to the network?
You know, it's interesting because, the rural facilities are mostly in the upper Midwest and a few in Minnesota, but mostly in North Dakota. And these are very small critical access hospitals. And fortunately, the state of North Dakota, at least not in our hospitals, has not as of yet, I should say, had the same kind of issues as even South Dakota's had with the meatpacking plants. And certainly not had anywhere near the situation that we've experienced, say, in Phoenix or in San Francisco or Los Angeles. But, those institutions were also closed down to elective procedures. And what we've found is that for whatever reason, that population has been very slow to really want to return to the hospital. And we're not exactly sure why that is. The emergency room volumes are still low in comparison to normal. And the elective procedures have not picked up at the rate that they picked up in other institutions. So while the COVID presence in those hospitals has not been nearly as strong as others, I think psychologically it has affected the population there just as deeply.
Yeah, interesting. One of the other things we talked about, you sort of referenced this idea, but as a national system with a headquarters in Chicago, but obviously 21 states, how are you managing spreading best practices across all of your hospitals? Obviously, Dignity and CHI, which combined to form CommonSpirit, had been doing that individually, but now you've come together. How are you managing that process?
Well, it's really it's interesting. I believe that the COVID crisis, if you can say anything good about it, it has brought us together as a system, and everyone has sort of piled in together to meet this challenge. So on the one side, we have multidisciplinary committees, in some cases made up of 23 different medical specialties that are working every day on reviewing what works and what doesn't work, and developing strategies, writing policies, and developing different approaches that they shift over to the operators that we implement. The operators, we meet actually twice a week, but inside their own institutions, they're meeting every day. And they've developed their own relationships so that, for example, last week, one of our operators was having a real difficult time with just staffing because of the ICU issue. She sent out a email to me and all of the other operators, and they all responded promptly in different ways that they could help her, either with contacts or tips or with staff themselves. And so when a best practice is generated, so one of the groups that meets is the CMOs, and they talk about what's happening, and what's not working. When we find something that works commonly, then those CMOs take it back to all their different institutions. And so we have sort of numerous different, I guess you'll call committees or panels, where these ideas are developed, focused, honed, and then spread out back throughout the entire institution.
Interesting.
Or it's the entire system, I should say.
Yeah, sure. Interesting. And lastly, Marvin, I want to pull back a little bit on this. So obviously COVID-19 has shed light on the disproportionate impact on populations of color that the disease has had.
Yeah.
The reaction of and the national unrest after George Floyd's killing obviously layers on top of that, and the focus on institutional racism that is gaining more light these days. Talk a little bit about what that means to your system, to CommonSpirit, and how you might be able to start to address some of these things, even as you start to see some financial pressures as a result of COVID. And so are you still able to focus on social determinants, for instance, while some of the other issues?
Well, clearly financially, we took a very hard hit during the last 3 months, and we're not the only ones. All of the healthcare systems did. Because of our size and the resources, we've been able to manage our way through it. And as we plan for the future, we know that it'll take a while to get back to normal, but we're very confident. Now, of course, whatever normal is going to be, but we're very confident that we'll be able to manage our way back to a reasonable structure and regain the strength that we have. Taking care of the poor, the voiceless, and the vulnerable is integral to who we are. So regardless of whatever our financial circumstances may be, that part of us is not ever going to change. And so not only do we view it as sort of critical to our mission in the sense of why we exist, we also think it's good healthcare.
Sure.
We have noticed that in our markets where we have capitated lives and where we have resources dedicated specifically, social workers, care coordinators, and nurses who are paying attention to the social determinants of health for those patients by going to their homes, going into their communities, helping them with their medications, and a whole host of other issues, dental, getting transportation, etc. Their health improves. And under a capitated structure, they're not using as many resources, and therefore, not only are we making a better financial decision for our system, we're making a better health decision for them. So I see that as critical to where we go in the future, not just for a specific population, but we've been talking for years now about moving away from being being sort of acute care centric to being continuum care centric, and managing social determinants of health is a key component of that. And I think this crisis has taught us that, and that's it'll be a part of us as we move forward as well.
And so the last question here, building on that, we're seeing a lot of communication from executives across the industry about institutional and systemic racism. What are you hoping will come out of this over the next, say, year to 2 years?
Well, and if in our institution, we've developed a very strong structure around this issue. Lord and Kevin have communicated extensively, both internally and externally, on this issue. I have met with my staff, and we've had open sessions around the issue. As a person of color, I think what we ask for is just equal opportunity, and to be treated just like anyone else would be treated. And my hope is that the nation, and it looks that way, has sort of looked out and said what has been occurring has not been right. This has been wrong, and we need to put in place the types of policies that give people, everyone, the same opportunity. Now, what they make of that opportunity is up to them, but it's very hard to succeed if you're not, no matter how bright you are, if you're not given at least the opportunity to compete. So my hope is that as we go forward, I guess a couple of things. One is that we're all people and we're all in this together, and COVID doesn't seem to care whether you're black or white. It kills everyone. And so if we could just recognize that, we're all on this earth here together trying to succeed, take care of our families. We all have the same goals. We want to be good people. We want to raise our kids, and we want to contribute to society. And my hope is that everyone will recognize that. And those people whose hearts are filled with hate, maybe they'll open their eyes and see that I'm not any different than they are. I have the same goals. I got kids. I want my kids to grow up. I want them to be safe. I want them to be successful.
Yeah, it's a powerful message to end on there, Marvin. So we appreciate your time. Thanks so much for taking time out of your busy schedule, and stay safe.
Thank you. You do the same, and I appreciate the opportunity.
Thanks. Now, I'm Matthew Weinstock with Modern Healthcare. That was this edition of The Checkup. Be sure to come back on July 6th for our next interview. Thank you, everybody, and stay safe.